My name is Abayomi Durojaye. I'm a medical practitioner from Nigeria, and I have an organization called SESI Health. Our focus is to change the face of healthcare system in Africa, leveraging exponential technology. And I'm going to be talking about the topic you can see on the screen: demonetizing and democratizing healthcare, leveraging technology. Now, our agenda will be that I'll introduce and then I'll look at the healthcare burden in Africa, as well as look at the fact that most of the healthcare needs are primary care and not rocket science. Technology being a resource liberating force, how that comes about. And then we'll look at the converging technological tools that will change the narratives. And then we'll look at examples of smart devices that are coming out to demonetize and democratize quality healthcare, the impact of which will be major in the developing world. So I go on with this bit of introduction. We all know that health is a vital resource in the race of life. And that means that when health is challenged, everything loses value. See, the healthcare needs that are taken for granted in the most developing world, in most developed worlds, are largely absent in most developed.
One thing, we can't see your slides. If you want to show your slides, you have to share the screen.
Oh, I am sorry. I am sorry.
No, no worries. I just wanted to say that you're not thinking we are seeing your slides.
Okay, I thought you are seeing my slides. Let me go and share. I'm sorry. This is the beauty of technology. Thank you for giving me that, Thomas. So now you should be able to see my screen. Can you see me now?
Yes, now we see your screen, and now you have to go to your slides.
I apologize, everyone that has joined. I apologized. So I apologize. So please, let's go back to the slide, and I'm going to quickly run through what I said before. Can you see my screen now?
Perfect. Wonderful.
Good. Okay. So the topic, like you can see, is demonetizing and democratizing health, leveraging technology. Simple meaning of that: demonetize, reduce the cost; democratize, make it available for everybody, irrespective of financial status. And the introduction, we look at the introduction, the healthcare burden in Africa. Most healthcare needs are primary care and not rocket science. And technology is a resource liberating force. We'll see how that applies into healthcare. And then we now look at how convergence of technological tools will change the narratives and how smart devices are coming out to help demonetize and democratize quality healthcare, the most impact of which will be felt in the developing world. I mentioned before, health is a vital resource in the race of life, and that's why the World Health Organization says that health is a complete state of well-being, a complete state of well-being in terms of mental, physical, and social well-being. When health is challenged, everything loses value. Now, in the developed worlds, most of the healthcare provided, they are taken for granted and they are even ignored. But then when you come to Africa, when you come to developing world, those things that are readily available over there, they are largely absent in these developing countries. In fact, surviving basic health challenges is like a miracle in most cases. I'm talking from sound experience over close about 2 decades in both developing and developed world. Health care, human capital, and resources are depleting daily due to massive exoduses of homegrown doctors and nurses. Between January and June, about 1,000 doctors passed PLAB and moved to the UK. That is alarming, despite the fact that there are not enough. Developing world must now begin to take advantage of the convergence of technology to create a solution to our health, to solve our healthcare problems. Now, this slide is one slide that is so burdensome. Healthcare burden in Africa. Africa bears 25% of global disease burden, but has less than 3% of global healthcare workforce in terms of nurses and doctors, among others. This is grossly inadequate. But now, take that on one side and look at the other side. On the other hand, North America only carry 3% of global disease burden to battle with and has over 25% of global healthcare workforce. And on daily basis, huge number of healthcare givers still move from the depleting numbers that are in the developing world to developed world. That worsens the situation the more, plunging the healthcare system into worse situation. 60 to 80% of healthcare needs are primary care. Check it anywhere. And it is these are basic in terms of malaria, in terms of upper respiratory tract infections, wound, basic immunization that are needed, hypertension that is the beginning, diabetes at the beginning, asthma cases, COPD, and annual medical checks, well baby care, refractive errors, lump detection and recession, among others. If all these are taken care of, 60 to 80% of healthcare needs in developing worlds are off. But most of these needs are basic. They are largely unmet in most healthcare systems. These are, you get to a primary care center, you get to even comprehensive healthcare center, all these needs cannot be met. Immediate basic care are absent or expensive, and conditions are not diagnosed early due to poor diagnostic tools, due to lack of human resource. And if you look at that, it is the delayed wound that will become gangrenous. Delayed wound is will need primary care, but when it's delayed, it becomes gangrenous or infected, and then we need a secondary care. It is the prolonged high blood pressure that was not diagnosed early or treated early that will lead to organ damage, that will need secondary care. It is the undiagnosed lump that will have mitotic change that will lead to end-stage disease. These are basic things. When you go to a community, particularly in this part of the world, you go to a community, you see a woman with breast cancer and is thinking is boil. You can imagine that, and until everything goes haywire and is destroyed. Why? Lacking early diagnosis, lacking early needs for care. Now, enough of dependence on donations and aids. Developing worlds are largely depended on aids and donations. These are largely not sustainable. You can get a donation today, you won't get it forever. If we don't begin to reinvent the way we receive healthcare. And I began to think about that a couple of years ago. And I got myself involved in what are the solutions to this. I now began to get a research. I found out that over the years, technological developments has proven to be resource liberating force. It makes what appears to be scarce to be readily available. So I begin to think, if we can get technology, adapt it in a way that is culturally and culturally acceptable by the people according to primary health care, we may be able to change the face of health in Africa and other developing world. Then I saw this. It's the third. Scarcity is relative, and really scarcity is relative. Aluminum was the third most common element in the Earth's crust, and the most abundant available metal on Earth. It makes it hard to imagine in that. That fact makes it hard to imagine in that in 1850, aluminum was more valuable than gold. You can read this story. These are facts. Aluminum was prized at $1,200 per kg. And at that time, gold was priced at about the half of that cost. It's appalling. And you can, if you look at this picture, this is a symbol to show that aluminum was very, very, very expensive at that time. It's a monument in the top of this monument was made of silver, of aluminum, to tell you that at that time aluminum was really, really more expensive than gold. That tells us that until that year, when the process of electrolysis was invented, technology came, changed the way aluminum was extracted and made it so easily, readily. At that year, the price crashed and went so cheap, became common. That's why you can see aluminum being used for anything. We can go on and on. This is a story, rapid tech development. Look at this picture. In 1956, this 5 megabytes of a 5 megabytes is sold for $120,000. But in 2005, this 128 megabytes was sold for $99. And then about 10 years later, it became cheaper, 1,000 times cheaper, 128 gigabytes, sold at $99. That shows that technology, rapid tech development will make things that are appearing expensive becoming cheap. Now, let's look at these few things. Whatever goes digital will be initially rejected and people will be skeptical. It goes to deceptive phase. At that time, it's still developing bit by bit. Everything, anything, health, tech, whatever it is, it develops bit by bit. As the times goes on, people begin to accept it. It disrupts the market. When it disrupts the market, it makes the existing technology to be obsolete. When that happens, the people producing that technology, they are encouraged. They feel that we need to increase it, we need to improve it. They dematerialize, they become smaller. And that's why bigger phone before are now smaller. Camera, you need camera before, now is now an app. You can see that it dematerializes. When it dematerializes, definitely the cost of producing it drops. And that means the selling price drops. It demonetizes. When it demonetizes, it becomes readily available for everybody and democratizes. So that is my basis of thinking. Now let's come back to healthcare. Sorry, this converging exponential technology will improve healthcare really. Everything in terms of 3D, robotics, sensors, materials, science, augmented reality, artificial intelligence. They have started, and I'll show examples as we close this, because this is going to be my last slide. Now, healthcare will leverage on all these things that I've mentioned, and a couple of technological firms, they are leveraging on it. I'll place an example first on HiNetra. HiNetra makes, if you want to go for eye test, you know, they give you a glasses, they change the lens, and then can you see, can you not see, like try and error. But that is going obsolete right now, because a technology is being used, not just HiNetra, a couple of technological firms, they are developing a kind of virtual reality. You play a game, bring a dot to meet another dot, and then it will give you exact size of the glasses you need. It will appear on your phone. That is awesome. What will that do? That will reduce the need for specially trained person to do eye tests. That will reduce the need for you to be queuing for eye tests. That will cut down the cost. Now, Clarios is making a digitally enabled scan, whereby that is even working close to a CT scan. A couple of things like that. AliveCore ECG, iMetrix ECG, Moonshot wearables, they are doing a lot of devices that can. So when all these technologies converges, all these technologies, when they converge, AI powers a device, and then is able to remove the necessary need for, okay, a specialist must be on ground to solve this problem. Then healthcare becomes demonetized and healthcare becomes democratized. And I think this is what we should embrace. the focus of my championing this talk is to begin to challenge every one of us in terms of those who are producing, those who are stakeholders in healthcare, those who are producing technology, those who are paying for healthcare, those who are making medical devices, those who are buying healthcare, the patients themselves, and insurance companies, to begin to look at how do we invest and make sure that instead of giving donations, let's begin to invest on technology that can solve the problem and reduce the dependence of developing countries on donations, and still be able to provide quality healthcare in a way that is mutually acceptable, that is mutually beneficial to everyone. I conclude with the fact that trade is better than hate. Developing worlds must begin to rise up. Developed countries must begin to come together and see how we can globally demonetize and democratize quality healthcare in the world globally. Thank you very much. If we have any questions, we can just go on and ask. Thank you. Let me return to the slide. Right.
Yay, here we are. Thank you. So yeah, we have a lot of chat, questions, comments. So where shall I start? So like Matthew wrote from Hello Yomi from Healthcare City, USA. What are your current barriers that you experience? So I just show it in the stream. You see it here.
Okay.
So what are current barriers that you are experiencing in Nigeria and how you overcome them when it comes to technology implementation?
Oh, thank you. Thank you, Matthew, from Nashville. That's good. Thank you. Your question is it's a common thing. For anything that is coming new, there are barriers. Barriers will definitely come. And like I used to tell, because I coach young people, I used to tell that it takes a lion heart to take your lion share. So for anything that is coming, you must be determined. There will be people that we condemn that, no, it's not going to work. No, when someone suggested that a plane is going to fly, I remember a story I read. They even threw them into the prison. That no, that is devilish. That is evil. You can't think human being will fly. Anybody that is flying has witchcraft or something. So the same thing, we are seeing those are the people adopting it is not easy. Like about 2 weeks ago, because I met a couple of technology firms in Nashville, and I said that, see, we need some of these things to come to Africa. And about 2 weeks ago, one came to Nigeria. You cannot imagine that you have like minds thinking in the same way, accepting that technology. So you can do your ECG where I am right now, and I'm not a cardiologist, and then the cardiologist is anywhere. He can read it, give you interpretation, and you have whatever you need to do at the point. This was not existing before. We need to begin to, like iMetrix. iMetrix did that, and is the new ECG device that can do a 12-lead ECG, and you can have it results with you, and your cardiologist can read it anywhere. This is what is needed in this part of the world. And we can go on. So yeah. Breaking barrier.
Sorry to interrupt, because we have a lot more questions. For example, okay. I think that would be interesting. You can connect your comments, because, for example, what Mia wants to know, what projects are you currently working on? And are these self-funded by you as a doctor? So she wants to know, like, yeah, what are you doing?
I don't know where you're speaking from, but right now, my project is, okay, in the past 2 years, I've tried to research, find people, technology firms that have ideas and technology that we can bring together and use it to bring up a smart pharmacy, a smart clinic that we can replicate across. We want to use that smart clinic to bind the West Africa together, to build Africa. Help these devices, this clinic, smart kind of clinic, will be able to be like, let me say, like a reinventing a CVS pharmacy, sort of, that will provide basic and primary care across West Africa. And it's starting in Lagos. It started in Lagos. So we started in a unit. We're going to replicate it across Lagos and then across Nigeria and on like that. That's the project. It's called Care Clinic. Sorry, Care Response Clinic. And that's Care means rapid response clinic. I can share that with you if you are interested. Right now, it is fun. Before you can get people to be interested in your project, you must first throw everything you have into it. So right now, it is funded by me and my friends right now at the moment. But I'm determined. My mission is to change the face of healthcare system in Africa, leveraging on technology. So I am determined to push it through until it gains traction, and then we can succeed with it. Thank you very much, my Brick.
Then I think an interesting comment or question as well from James. He wants to say, like, how should an ideal world look like for you having support in Africa? So all the things what you're doing. So yeah, what support?
Sorry, I don't understand this question.
I tried to figure out what James wanted to say, but I believe, like in an ideal world, you know, what is it? What do you need?
Okay, so for me, because there is something about, there is always a message about Africa. Oh, when you need support, people want to. There is an idea that anybody in Africa that is talking to speak to you on support and all that want to take your money. Maybe that's what he's referring to. And there are a lot of experiences, and I cannot blame anybody for saying that. But the point is, there are very bad people in every place in the world. In Africa, there are bad people. In Africa, there are good people. In Europe, there are bad people. There are good people. Bad people everywhere. But we will not throw away the baby with the bad water, right? If we do that, good projects, impactful projects will not go on. So in terms of support, for me, I will not beg for money for anybody. If anybody is interested, it's going to be a part of it, like it's going to be a part of it, like in a mutually beneficial way. That's it. No, give me, I will. No. We are not built to be beggars. No. So collaborative partnership is what we look out for. But then it has to also be well-defined and well-detailed. I travel to the US and to the UK often, and like I'm speaking here, I'm going to be speaking at Future of Healthcare in the US, in the UK, London, in March, on the same thing, changing the face of healthcare system in Africa, leveraging on technology. What I want to stamp on is that we do not want to depend on hate. It cannot take developing world to anywhere. Everyone must innovate to create something good for their community. And that is what we are set to do.
Yeah, so time is already over. It was very nice having you with us. And yeah, definitely looking forward to your next project and what you are working on. So thanks again.